Good evening. Thank you for joining me tonight, everyone. It is 8 p.m. Eastern here. I'm
Recording in
here in New York. I see we have a couple of people here. We're going to wait for folks to trickle in. People are already saying hi. In the chat, please maybe introduce yourself, your name, your state, and what the best restaurant in your local city is. We did weather last time. I think restaurant will be more interesting. In the chat here, we have all three people I know. Deepa, it is good to see you again. Hope everything is well. Steph, hi. Thanks for joining us. I hope the new job is okay. And Eric, wow. I don't know if this was too late for you, but thanks for joining me after your job. Eric puts in here a recommendation for a restaurant name I don't know how to pronounce. Is this restaurant even in Honolulu? When I Google it, it says it's in Tokyo, Eric. Where is this restaurant? As people are trickling in, we're just doing a couple of intros here in the chat. Name, state, and your favorite local restaurant that you would recommend to people coming to a place near you. Haley, how are you? Good to see you again. For folks who are just joining, please do some interest here in the chat so we can get to know each other, because we want tonight to be engaging, for you to ask questions throughout the conversation as I go through some tips and tricks for new practice owners and how you find your first clients. Hello from F, which I take to mean Florida, but SW19, tell me if I'm wrong. Tia from Arkansas. Hi, Tia. Prelude breakfast bar. Oh, that sounds good. Yes. Any type of breakfast food is good. That's my take. Florida. My name is Samia. Florida's great. I just got back from Texas for a conference, Texaba. Actually, my friend over here, this is Paco the Alpaca, is the name that we've come up with for him. Paco came with me to the conference, Texaba, but someone actually tried to steal him at the conference, if you can believe that. The last day I walked in and he was not on my table anymore. But luckily, we recovered him. So he's back, and he will be joining us for tonight's webinar. Couple more minutes here as people are trickling in. Put in your name, your state, and your favorite local restaurants, so we know when we visit you where to go. And I really do visit practices. People don't believe me when I say this, but I was visiting a couple of our friends in the Dallas area. I should be out in the Colorado Springs area in June, visiting a couple of our amazing practices that are developing out there. Yes, Eric, I agree. Oh, hey, Mick. Thanks for joining. It's 5 after here, so I'm going to go ahead and get started. As people trickle in, please make them feel welcome. Say hi. This link is publicly accessible to anybody, so please feel free to take this link and post it on Facebook, Instagram, in your text group chats, and share the knowledge with more people who are looking to start their own ABA practices and just need some practical tips as to how to go about it. So let's get started. Today, we're going to talk about local marketing for new ABA practices. I think this is the best way to find your first caseload of clients and to get your name out there. It's not by endless social media, ads, SEO. It's just by knowing your community better than anybody else. Bit of an intro about me for folks who don't know me or Alpaca. My name's Michael, and I'm one of the founders here at Alpaca Health. Before this, I worked in education. I built an online tutoring company up to 400 students a year, 80 tutors, 80 coaches, and we worked a number of cases who had special needs or had IEPs, and that's how I came across the world of autism. I met a couple of BCBAs and realized that while it was pretty easy for me to start my tutoring company, I just needed a student and a tutor and got to work. It was a lot harder for BCBAs. And I just really liked starting the tutoring company. And so now I have the privilege of working with dozens of BCBAs across the country in starting their small local ABA practices. Alpaca Health, we're dedicated to BCBAs starting and owning businesses. And the reason why is because we believe the future of this industry and healthcare generally should belong to clinicians who put quality first, not big box corporations that churn out numbers. You know who I'm talking about. I don't need to say them. What do I think this means? I think this means that you should own your finances. If you do the work, you should get paid for it, period. Agencies are taking an enormous cut and not adding that much value. We think clinicians should own your time. If you have a master's degree, or I know many of you have higher, you should be doing the most important work possible, spending it with families, changing lives, changing behaviors, instead of on hold with insurance. And lastly, we think you should own your clinical judgment. Over the past couple of months, I've talked to way too many families who've been discharged from services early, can't find a good fit practice for them, just because they do not want their child to be stuck in 40 hours of ABA in a center all week long. I talked to a family who was literally, the clinic was basically forcing them to have the child at clinic until 10 p.m. at night. It's absolutely insane, some of the practices that are going on. And we think that you as a clinician should make those decisions, not weird policies. And so how does Alpaca help? We help you start an ABA practice by providing all-in-one AI technology that covers data collection, scheduling, payroll, and automatically writes your session notes. We do all admin for you. No more waiting on hold with insurance, verification of benefits, prior auth, patient responsibility, and so much more we do for you so you don't have to. And the last part is we give you financial peace of mind. Every 2 weeks, we pay you out, even when insurance takes longer. And best of all of this is free for providers. We make our money off of commission of the insurance reimbursement. Why do we do all this? Because it comes back to our mission, making sure clinicians are in the driver's seat instead of financiers. So that's about us. That's about me. Feel free to reach out and go to our website if you're interested in learning more. But today I want to dig into marketing. And before I get into specific strategies and tactics that I've seen work for the dozens of practices that we support, I just want to start by saying that marketing, sales, they're scary, scary words, and they feel like things that business people should be doing, not clinicians. All marketing is, though, is building relationships, and that's what each and every one of you as BCBAs is already good at. You're already talking to parents and parent trainings about what ABA is and giving them practical tips and advice for how they can better support their families and their learners. That's marketing. Instead of saying that to a client, you should say it to the world. So the world knows how they can better support their learner and that you have really great advice for folks like them. As a local provider, you have a huge advantage over some of the corporate ABA chains that exist out there. These big box ABA companies, they spend on ads, they have big brochures, they send letters to people, they call people, they buy Google ads, they do all this stuff, but it comes off as inauthentic because it's this polished, bureaucratic company spamming Facebook groups with flyers. You are not that. You are an individual clinician starting a small business. You understand your community, its unique needs, culture, resources, funding sources, school system in a way that a lot of these national companies can't do. So you want to lean into the fact that you're small, nimble, and clinician-owned. And then the last and certainly not least is you're here for the long haul. You're not just here when reimbursement rates are high. And so you can invest in building relationships in ways that a lot of other practices just aren't doing. And so today we're going to cover using this framework of marketing is building relationships to cover the 3 biggest tactics that I see work for providers we support. The first is, how do you get a brand together in a week? The second is, How do you start building strong referral relationships from day one? And the last piece is, how can you use social media to your advantage without feeling inauthentic? First things first, if you are starting your practice from day one, you have to have a brand. You have to have a website. You have to have a name. You have to have a logo. And the list goes on. And it can feel extraordinarily daunting to figure out what to do. I think in this stage, there's just a lot of decision paralysis among providers we work with. They get stuck on, what's the perfect name? Is this a good name? What's the right logo? I have 7 different logo options, Michael. What do I do? Do I need to hire a designer or a website builder? You want to start simple, start small, and just go. Because right now, you don't have a business yet. There's nobody who is going to be incredibly embarrassed by the name you come up with, besides maybe yourself. You just need to start. And so, a couple of pieces of advice here. The first is, with the name, keep it simple. I encourage folks to include ABA in the practice name so it's more findable in Google searches, on Facebook searches, or more. Many of our practices also do behavior solutions. That's okay, but ABA can often be the key term that folks are searching for. Time box and good is good enough. You want to set a deadline. You want to commit to decisions quickly, because you'll always change later down the road. This is something that a lot of BCBAs don't realize is, if you start with the name and you don't like it, you can change it. The state doesn't care if you change it. The website doesn't care if you change it. You can change things like your logo, your name down the road, but you need something to start. You need something to start. How do you get things together quickly? Well, Haley and Megan already know what I'm going to say, but use AI. We are an AI company. We create software that is AI native from day one. So obviously I'm a little bit biased here, but Haley and Megan here in the chat are absolutely correct. Using AI can be an incredible tool to quickly setting up brand. So let me show one message here. I created a logo with AI using Claude in 3 tries. I created a logo with ChatGPT and refined it in Inkscape, maybe 15 minutes total. Inkscape is maybe more advanced than most of you guys need. Setting up a brand can be really easy with AI. ChatGPT can be a great resource in creating graphics, but then also generating ideas for names, mission statements, descriptions of your service offerings. Canva has a number of professional logos and graphics. It also has AI now built in for you to help with those graphics. And then your website. I have a lot of practices who use Squarespace, GoDaddy. They're fine, but there's new AI tools, one we recommend called Durable, which lets you build a website in minutes by just telling AI what you want the website to look like. You can build your brand in not just less than a week, less than a day. I dare people in here who haven't done it yet. Time box yourself for 30 minutes and see how much you can get done with some of the amazing tools out there. SW19 says Copilot AI. Yeah, you could probably use Microsoft's built-in solution if you are a fan of Office. And if you don't believe me, what I'm going to do is I'm just going to quickly share my screen, and I'm actually just going to build a brand in, let's say, less than 5 minutes. So I'm going to open here to ChatGPT, and I'm going to tell it what I need. Generate ideas for a ABA practice, a mission statement, and ideas for a logo. You probably want to give it a little bit of information about your practice. I am located in Dallas, Texas. I want my practice to be focused on parent training with an emphasis on caregiver involvement. I think that the whole village, not just parents, should be involved. Give me options. And so now ChatGPT is going to generate a whole bunch of ideas, some of which may be really bad, but probably you can use to come up with really, really great ideas of your own. So let's look at this. Village inspired. Heart of the Village is actually one of the practices we work in Colorado. So this name is taken. The Village ABA, Together ABA, Circle ABA, Strong Roots ABA. I do like that. Care First ABA. This is a name of an insurance payer in Maryland. So if I was in Maryland, I probably wouldn't use this, but this sounds pretty good. Family Tree ABA. I do really like that. Kindred ABA. And then look, it even recognized that because I'm in Dallas, you can lean into the fact that you're a local practice who understands local landmarks and lean in. Oak Grove ABA, that is actually a neighborhood in ABA. Metro Family ABA, we call the Dallas area the DFW Metroplex. That can be one great strategy when finding a name, by the way, is picking a local landmark that you know your community will know and it'll resonate with the people in your local area. Because, like, let's be honest, a lot of these big box ABA companies, their names are so generic because they're trying to serve everybody in every 50 state. In your case, you're trying to serve 12 to maybe 24 clients, depending on whether you want to bring on another BCBA. You're trying to serve them in one geographic area with one clinical style or thesis. Mission statement options. You see some option here that are pretty good. Oh, I like this one. Very short. Empowering families, engaging families, transforming lives together. All this really, really great stuff from ChatGPT. I didn't realize you guys couldn't see that. Let me see if I can see if I can stop sharing my slides. Well, maybe you get the idea, is use ChatGPT to come up with stuff really, really quickly and use it as a brainstorming partner to try to figure out what works and what doesn't. So that's branding. That's how you can come up with really great, really fast brand ideas. Now, once you have a brand, what do you actually do with it? Well, I think the most valuable channel for a lot of our practices is local referral partners. So we're going to talk about that next. What is a referral partner? Well, a referral partner is anybody who has clients that you might want to work with. And there's a huge list here that we'll go through. I think a lot of times when people hear referral marketing, affiliate marketing, it feels really like sleazy and businessy and salesy, and it's not what we as clinicians at BCBAs do. I think good referral marketing is actually just setting the stage and building relationships for care coordination later on. If you build a relationship with an SLP and you guys share a client together, you can pick up the phone, call them, and see how that client is doing on the SLP side so you can adapt your treatment plan and your protocols properly on the ABA side. If you coordinate care with the daycare that referred you a client, you can maybe do in-community services in the daycare if your payer allows it. Or maybe even just send the daycare some helpful hints about how they can better support this client while they are in the daycare. And so really when I think about building relationships with referral partners, it is not about selling. It's not about being sleazy. It is about working with people that your families are also going to be working with and supporting the whole village around a family and around a child. Now, this list of referral partners here has some really straightforward, easy ones, as well as things that you probably haven't thought about, but you should invest in building relationships with. What are the easy ones? Obviously, pediatricians, obviously, autism evaluators, and diagnosticians. These are, for obvious reasons, the primary referral source. And these are the only ones that big box ABA will build relationships with because it's super easy, right? It's like, oh, well, I'm going to go to every pediatrician. I'm going to pull it from the payer director. I'm going to call and send the donuts and flyers, all things that you should do. But I encourage everybody to go beyond number 1 on this list and go through 2 to 8 because there's so many other service providers in a family's village that you can really build relationships with. Mental health care providers are one that I think are deeply, deeply underrated. If you have a child if you're targeting early intervention cases, a 3-4-year-old, you are probably not going to see that child in talk therapy. But you might have therapists who work with adults with autism whose children need ABA therapy. You might have therapists who work with parents of kids with autism who need therapy for the child. And so these are therapists who can maybe not directly connect you with a client, but may be able to get you to a parent or some sort of caregiver who they know needs some help with ABA therapy. OTs and SLPs are a clear one, but one that a lot of the larger organizations miss, oftentimes because they're trying to build up their own OT and SLP programs. OTs and SLPs are especially great because if they already have a practice, they might already have some space, and you actually go in and share that space with them. We have one of our providers in Oregon who is working on building a relationship with a local OT clinic so that she can come in and deliver ABA while they're doing OT. Now, payers in her state allow for this sort of concurrent service delivery. But even if they didn't, you can imagine a world where someone finishes OT and then goes to her room in the clinic to do ABA therapy. So much is unlocked if you build relationships with these types of related service providers. 4, 5, 6, 7, and 8 get a little bit more unusual. Schools and special ed are clear about building these relationships. But I think people are missing all the different locations that have communities of special education, special needs kiddos. I think churches and religious institutions are one that are really, really underrated. I know a lot of the churches in my area actually had specific programs for kids with disabilities or special needs, both that are in their community, who go to that church or religious institution, but also servicing the broader disabled community in their local area. If you're already strong in your religious community, I think it's really easy just to tell other people that you're starting a business. If you're not, it never hurts to reach out and tell a program coordinator or a pastor you're starting this business, because these folks just want to help their community. Libraries are another one that I think are deeply, deeply overlooked. Families go to libraries. They take their kids. Even if they don't take their child with autism, they still go. And they're going to see flyers in the bulletin board. They're going to build relationships with their librarians. And those folks are in a position to refer you. The upshot here with this slide is to show you that there's so many different people that could refer you. I mean, there's probably so many more that you can think of beyond this slide. Can you talk to a local restaurant owner, a shopkeeper, go to a farmer's market? All of these people who just will know other people that you want to tell about you starting a local small business. One thing that you might be able to tell already with so many different types of people and so many different types of referral partners is that this, at this point, is all about hustle. It is all about putting in the work that big box ABA won't put in, right? No way a massive national ABA company is going to go to a local library to put a flyer up on a bulletin board. No way are they going to reach out to local churches to see if they could table at their next community event. No way are they going to go to the HOA block party to introduce themselves and to meet people in the community. Your strength as a clinician who is starting their own business in their own local community is going in these small places in the world that just aren't scaled enough for these larger organizations. You want to go in person to doctors' offices, to SLPs, to libraries. You should email and call and fax as well, but nothing beats showing up in person with donuts and coffee, so they like you from the get-go, materials that you can leave behind, and a conversation that you can have with these providers. You certainly want to introduce yourself to the front desk staff. They control access to everybody, especially in a doctor's office, and they're often the ones doing referral coordination on behalf of the doctor. So you don't want to overlook the people who are supporting the provider as well. Make a day out of this. Designate Friday your referral marketing day and spend all day Friday driving around, handing out flyers, and meeting people. It's certainly going to be tiring from the get-go, but it's worth it because these relationships will bring in referrals for months and years on end. And it just starts with in-person and a handshake. We do have a really great comment here. My community lets business owners put banners on the fence, social school workers, counseling, really great for referrals as well. All very, very true. Your local community probably has places for small businesses to market themselves. And school social workers and counselors certainly know where the need is in their student populations and can and will refer students out to additional service providers. The other piece is when you're going to meet with referral partners, try not to make it transactional. Try to make it about building relationships. Don't just say, hey, do you have clients that you can send to me? Offer to send clients to them potentially, to connect them with other referral partners that you have already met. And also see if you can not just leave behind a flyer that has your face on it, but also maybe include information about ABA therapy on the flyer, information about how to handle potty training, how to help your child develop social skills, practical value add things that that provider can then share with their patients. It's not just about getting a referral. It is about showing the provider you actually know what you're talking about and you can add value to them, their practice, and their patients as well. We have some other really great ideas here in the chat. I want to make sure that you see them. So let me just put them here on the stream. Monique says, I know all my local Starbucks spots and they let me hang large posters on their community board. Great idea, because when you are picking up your coffee, you're putting your milk in it, you're going to look at the bulletin board and you will be there. So that's a really, really great idea. And I'm sure there's so many other kind of spots like this that you know that big box ABA doesn't, right? The local YMCA is one that we've heard about. We've heard a lot about community boards at the HOA pool house or the HOA center get-together place. We've heard about bulletin boards at the rec center or the natatorium, the swimming pool in your local area. So that is a really great idea. And then one more that I'll share here, I think this is a really great one, is case management agencies. So SW19 is a clinical social worker as well, tons of referrals. A good portion is referred from a case management agency. And so that's why you became a BCBA. That's awesome to hear. That's really awesome. I think it's a great idea. A lot of states will have local organizations, regional centers, I think they're called, in at least California, that will be the hub for folks diagnosed with autism and then kind of spread that out to local agencies and providers. So definitely building relationships with those folks. And then you guys are great with ideas. Monique, summer around the corner, partner with summer camps. That's a great idea. Partner with summer camps because a lot of pairs will let you deliver in-community support. And if a kiddo with autism is going to a summer camp, they might need support. There's also special needs specific summer camps that you can find in your local community. So that is a really great idea. Really great ideas from everybody. Last thing I'll say on my slide here is sometimes people won't pick up the phone on the first try. Sometimes they're not going to pick it up on the second try or answer your third email. Or maybe the first time you go in person, they're going to say the doctor's busy. Don't just give up. Go again. Go again. Go again. Second, third, fourth, fifth, sixth follow-up. Over the course of weeks or months, that builds the relationships and shows you're persistent. Don't just give up after the first time. If you do manage to meet someone, send a thank you note, send follow-up materials, make sure they have a fax number. If you're talking to a pediatrician or an autism evaluator, almost certainly they're going to need a fax number in order to send you referrals. And lastly, if you meet someone you really click with, make sure to schedule quarterly check-ins to maintain those relationships, and continue to build those relationships. I feel like you guys have had really good ideas, and I have a few more slides here, but one question I want to ask everyone is, if we were to create a chat of aspiring business owners, of aspiring BCBAs who wanted to start a business, so that you could have conversations like these anytime, anywhere, where would you want it? And be honest, tell me if you would not join, because that's good feedback from me, so it's not something we spend time on. Would you join a chat of other BCBAs starting their businesses on Facebook, on Instagram, on text, on WhatsApp, on Signal, on LinkedIn, something else? Please help me answer the poll or put it here in the chat. I'm curious if you guys would actually join a community here. Deepa says WhatsApp. Awesome. Facebook. Okay. Oh, lots of Facebooks here. That's good to know. I think Facebook looks like the overwhelming winner here. I'll give it a couple of other minutes to see if anybody else has takes. Steph says, I'm old. I know Facebook. Well, I'm learning Facebook too. So good to hear folks like Facebook. Anybody else have a platform that they would join a community on? Let's see. Okay, well, Facebook it is, guys. Be on the lookout for an invite from me to a new Facebook group. Thanks for participating here. Now, we've talked a lot about which referral partners to contact. We've talked about needing to hustle. What do you say when you meet them? Here's a couple of tips from the conversations that I have seen happen. First is sharing your journey. Oftentimes, if you are meeting referral partners who are also small business owners, they also had a reason why they started their business. They also had an awful place they used to work, and that's what led them to go independent, especially clinicians in healthcare. And so be comfortable owning and sharing your story, being really honest and transparent about what led you to start your business. I think that leads a lot of people to build empathy with you. Talk about collaboration, care coordination, the fact that you're going to send referrals back to them, you're going to keep them updated. I found a lot of success telling pediatricians that after a referral's made, you'll send the treatment plan back to them so they'll have it on their records. So many companies don't even make this step of closing the loop on referrals and making sure that pediatricians and the folks that made the referrals know that their client is actually getting the services that they were referred to. One tip I have is, when you're talking about your practice, try not just to say ABA therapy. That's for two reasons. First is there's a lot of ABA out there. And the second is there's a lot of bad ABA out there, especially in many regions of the country where ABA is almost a bad word. You want to try to explain how your practice of ABA is different, it's special, it's unique. Talk about play-based therapy, talk about focus on parent training, talk about your one-tier model, talk about low dosage, talk about a focus on specific age groups. Whatever you think your clinical competency is or your clinical style you want to apply, communicate that to referral partners so they know how you're different and where your focus is. I think that a lot of parents and a lot of referral partners actually appreciate this versus, and all these big box ABA companies will do everyone, send anybody to us, just send us the referrals and we'll take it from there. But having kind of a specific focus for you can be really helpful in communicating your value. The other part is you want to find clinical allies in your community. Like, if you're someone who really cares about respecting neurodivergence and all that entails, don't just find like the autism evaluator who's been doing this for 50 years and doesn't know what that neurodivergence is. Find someone who actually understands the language that you're speaking If you are someone who really cares about play-based therapy, find an OT that thinks really heavily about play as an occupation so that you can not just build relationships with any clinician or any referral partner. You can build relationships with people who match your clinical style and you'd actually want to partner and work with. The last piece that's been really helpful for practices, especially in areas of the country like a Washington or a Colorado, where services have been abruptly removed from the community, is focusing on the fact that you are an owner in your local community. You're a small business owner. What happened in Colorado, I think 2 or 3 years ago, same in Washington, is rates got cut. All these big box ABA companies fled the state. Many, many kids were out of therapy. The state had to push back up rates, and now folks are back in. Small business owners, at least those that I've talked to, I'm sure there are some who had to shut down because of the Medicaid cuts. Many of them just kept going. They persisted because it's their community. They're not going to move to a different state to start a new ABA practice like all these national chains did. They just stayed, and margins got cut. Time was tough, but they continued delivering service to their community. And I think that there's a lot of regions of the country where this has happened time and time again, where emphasizing the fact that you are a local provider that has a local network and local resources can be really, really helpful. Woo! That's a lot on referral partners. A couple of things that Alpaca provides our providers to help them with local referral marketing. The first is a CRM for referral partners. So it's a place where you can keep track of all the different referral partners you've talked to, when you've talked to them, how you've talked to them, and when you're going to talk to them next, so that you can hold yourself accountable to building these relationships. And also conversational scripts for emails, for faxes, for texts, for in-person conversations as well. So if you don't have access to this and you're already working with us, shoot me a text and I'll make sure that you have access to it. Now, the second strategy I wanted to talk about is broadly social media, but especially Facebook groups. Most of you probably know this, since a lot of people want to join a Facebook group dedicated to people starting their own businesses. But there's a lot of Facebook groups out there. And there's especially a lot of Facebook groups focused on the special needs population, parents of kids with autism, and broadly moms in the community. You want to join these local groups. Find parent groups, find special need communities, find the neighborhood forums, go on Nextdoor. And when you're there, don't just market yourself. Don't just say, I'm starting a business, please, please, please send me referrals and post that every day for 5 days in a row. Join and add value. Answer questions when parents are asking about autism services or something that you have knowledge about. Make posts that offer general advice without direct self-promotion. And the reason why is because if you post, let's say, a graphic about what ABA therapy is or how to diagnose autism, people are going to recognize that you are some expert on autism and comment. They might go to your profile where they'll see BCBA and a link to your website. They're going to figure out that you offer ABA services and reach out. But it comes off much more authentic than just slapping a flyer in their face and saying, please join me, join me, join me, join me. So answer questions, post things of value, and contribute to the community before just spamming. And that really is the core piece of advice I give to everybody when it comes to marketing generally, but especially on Facebook groups, is lead with value. Resources, webinars, answers to questions. Ultimately, all marketing is building relationships. It's understanding that our job is to build relationships with everybody who has a need, not just the ones who end up being our clients. What are some pieces of content or helpful things that will help parents on Facebook groups engage with you? These are called lead magnets. It's like the technical marketing word. It's basically a magnet, like a piece of content or advice that will attract potential families or leads. 3 different types of things. Resource guides. So if you write a one-pager on how to do potty trainer, a one-pager on autism grants, a one-pager on best insurance companies for families with kids with autism. All of that really, really resonates. And what you can do is create these things, put your logo on it, and then gate it behind an email. So have them fill out a Google form, have them send you an email, have them comment. And then once they do, that's when you're able to send them that resource. And so it's a pretty equal exchange, right? You're providing value to them and you need some way of getting it to the family. So you collect their email. And then once they view the resource, then you can follow up over time to see if they need therapy. Not instantly. Again, you're leading with value. You're helping families in need, not just slapping them with a flyer and hoping they fill out your intake form. And then the last piece, and this is a piece that we have, obviously, since you're in here, done a lot of to help reach BCBAs, but also we want to start helping BCBAs do to reach families and communities, is host webinars like these, host parent education sessions, host tactical sessions on behavior reduction, put together a presentation, reuse parent training curriculum or presentations that you already have off the shelf, record it all, and then that way you can use it either as a resource that you put on these Facebook groups, you can clip them up to put them on your social media, and you can really generate educational resources for the community in a really easy way. I'm going to try sharing my screen again because I do want to show you how we've done this to some degree of success. So let me share, and hopefully you guys actually see it this time. So are you guys seeing my screen? Can I get a thumbs up or something here in the chat if you see my screen? Hopefully you guys see my screen, maybe. Yes, okay, I got a yes, perfect. So what I'm sharing here is my personal Facebook. You can, I recommend using your personal Facebook. A lot of groups won't allow pages. So if you're comfortable with it, use your personal Facebook or create a new profile just for your work. Let me show you a post that we did in a Facebook community that I think added a lot of value, started a lot of great conversation, and resulted in a couple of leads. So let me open this one. So as you can see here, here's the post. Hello, I put together a resource guide to grants available to special needs families in the DFW area. Note, I'm leading with value, a resource guide, and I'm focusing on my community, the DFW area. Hope this is helpful. Quick intro, I'm with the network of local clinician-owned autism therapy practices. And then also even leaving a note here that says like, hey, like, I don't know if this is allowed or not. Please remove if it is not allowed. And that just kind of shows a lot of respect for the moderators who honestly have to deal with a lot of self-promotion. I also created a quick Canva graphic just to make it a little bit more visual. And then this link here, it takes you to a resource guide so that you can actually get access to the resource and see what it looks like. If I were not the creator of the resource, I would actually have to fill out my email. So you should see on the screen here a little bubble that says, Michael, request your action. Continue email. In order to see the resource, I have to put in my email. And once I do, that's going to be stored. That's going to be stored in your system so you can follow up with them as needed. But once you put it in, you're able to see all these different grants that I've put together. So we found that is a really great way of engaging the community and getting leads is first, lead with value, and then collect contact information so that you can follow up over time. We do some of this marketing for our practices, especially those that are just starting out, so that we can help them with some leads. But we also teach you how to do it yourself so that you're not just reliant on the Alpaca Health team to help you with your marketing. And you can really start to build relationships in your community and position yourself as an expert on ABA in your area. Now, I talked about webinars and building content. That's another thing that Alpaca Health helps our providers do. So I'm going to share actually our Alpaca Health family channel. This is a set of webinars that we're putting together on behalf of our providers. You can see one that we're doing in 2 weeks with Ethan, a new provider in the Austin, Texas area, about how to spot green and red flags in autism therapy, hopefully targeting families that are navigating services for the first time. Michelle in Long Island in New York doing a webinar on how to build social skills, because that's one of her focus areas. Is she wants to focus on doing after school, weekend social skills groups. All of these things, they are really easy. They're all just about communicating and presenting information to an audience of parents, things that you have already done. And so as we close up here, if you're just starting out, here's your guide to finding clients in 30 days or less. Get your branding done, do local outreach, join Facebook groups, generate value, whether it's resource guides, webinars, and put them out there in the world. And I think if you do all of these things, you will have no trouble finding clients and also building relationships with the people and the networks that will be your referral sources for hopefully many, many months and many, many years on end. So that's it from me. We have 12 minutes left here. I know I went through a lot, and I know the chat also had some really amazing ideas. So I wanted to open up the floor for some discussion here to see if there are questions that you want me to answer, or frankly, other folks in the chat to answer. Questions about Alpaca, questions about marketing, questions really about anything related to starting up an ABA practice. So please feel free to put it in the chat there. Any questions you have that you'd like us to think about to answer. And what I'll also do in the chat is put a link to our website where you can learn more about Alpaca Health, what we do, and also sign up with a free consultation with me so that I can tell you a little bit more about how we have helped dozens of practices across the country get started in sometimes 30 days or less. I have a fun question here. Deepa asks, how did you come up with the name Alpaca? The honest answer is we were just looking for a pretty cute animal, and I think alpaca is a pretty cute animal. It also means that we're able to have this fun guy as our mascot, which is really helpful when it comes to marketing, brand building, and the conference circuit. I will be at ABA International Memorial Day, and if you guys will be there, please stop me so I can get you one of our plush alpacas. They go out really, really fast. So truly, if you want one, you need to let me know so I can save it for you. Thanks for the question, Deepa. Monique asked, does Alpaca require a contract? We don't. You can leave anytime. You can take your clients with you since they're your clients. You did all this local marketing to find them. We charge no fees. You'll never pay us. It's never an invoice. We make our money off of insurance reimbursements. And so if you stop seeing clients and families through our insurance relationships, that's no worries. Alpaca, we do sign a contract that specifies what you'll be paid every 2 weeks and when you're going to get paid those things and what Alpaca does so that there's kind of a clear delineation of responsibilities. But we don't have term limits on our contracts. Everything is a commission off the insurance reimbursement. So if you do more insurance funded work, awesome. If not, no worries. We don't charge for private pay. If you create your own school contracts, we don't take a cut of those. We make our money as a commission of the insurance reimbursement. And if you have anything else that's non-insurance, you can use our technology. You just market private pay and collect payments outside of it. Tiaj asks, how long are Alpaca's services available for? Lifetime of the business or contractual? So I guess probably similar question to Monique's. You can leave anytime you want, but we would love to work with you through the lifetime of the business. I think that's really the goal, is we are set up to help you launch your practice, working with you on LLC incorporation, getting your EIN, deciding between LLC and S Corp, connecting you with accountants, service providers, helping you find your first client, your first staff, to running your business, providing all-in-one AI technology, done for you admin, making sure you get paid every 2 weeks so you can pay your staff with no worries about the finances. And the last part is, if you're ready to grow your business, partnering with you on marketing so that you can grow your brand and serve more families in your local community. Fun question. If we utilize Alpaca services, do we also get an Alpaca plushie? I'll show you the Alpaca plushie. Yes, you do. In fact, our earliest practice, and they've been doing really, really well. The Heart of the Village in Colorado, Jackie Canales. We sent her a big alpaca like this one, but the bottom of the alpaca had a zipper that you could unzip, and then many of these little alpacas came through. So that's our new welcome present to providers who start seeing their first client with us, is a big plush alpaca with many, 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 many little plush alpacas for you to share with your technicians, your kids, your clients, or just yourself. So that's a fun question. Deepa asks, how many providers do you have now? We work with about 24 across the country. Monique asks, how do you manage working with BCBAs in the same region? Isn't that a conflict of interest? I think there's enough clients and cases to go around, honestly. We need more locally owned small businesses, not fewer. We're not a franchise. We don't create territories. We don't charge onboarding fees. We don't have cash reserve requirements. And that's because we just want to make it as accessible as possible for amazing, mission-oriented, clinically driven BCBAs to start their own business. Eric asks, how do you do payroll? Or do you do payroll? The answer is yes, we do payroll. So we have built our own payroll module. It's just like ADP or Gusto, except it's integrated in the Alpaca technology platform. We do that because, and it's almost insane to me that no other software platform has done this, but if your schedule has drive time, start and end time of sessions, then why would you need to copy and paste that into a payroll platform just to run payroll? Why wouldn't your practice management system take your schedule and just do payroll for you? It's kind of obvious, right? And that's what we do. We have payroll, and we do it all for you based off of Alpaca schedule. This is a quick one. Do you work with Medicaid? Yes, we do. We have contracts with Colorado Medicaid. We're close to Texas Medicaid. I think we have it back with Tennessee Medicaid. Obviously, Medicaid is state by state, so it depends on your state. Tiaj, if you're interested in learning more about our network access in your region, just book some time with me, and I'm happy to kind of talk it through with you. Megan asked, does Alpaca create employment and other documents needed for new staff? We do. In fact, I think, Megan, you should have access to that big resource folder that has all the guides and all the Excel spreadsheets. One of them is a template offer letter that you can use to make an offer to a potential BT. Monique asks, also, does Alpaca require the BCBA to operate only locally, or do we allow owners to start a company remotely if they do not live close to the region? We do allow for remote BCBAs because we think that telehealth is good, and a lot of BCBAs really, really know how to do it. We have a pair of BCBAs starting a business together. They live in 2 separate states, and they're starting their business in Colorado. We have a BCBA who lives up in New England and starting a business in Texas because she has licensure in Texas and has been doing telehealth forever. So there's no requirement for you to start your business in your local area. You can totally start it in any state in the country you want. We obviously have recommendations and places where we can get you live faster. If it's a new state for us, then it'll take us some time to get online. Really great questions, guys. 4 minutes left here. Anything else that anybody wants to ask about Alpaca, about what we do, marketing? Megan, am I the first California? You're the second California provider, Megan. So almost. I think you were like a week apart, so we can call you guys tied for first. Eric, still thinking about doing DOE and other services. Obviously, we want to open as much network access as possible. So I think education contracts, CHAMP VA, non-insurance payers, employer-sponsored plans that are non-traditional insurance payers, all of that we want to do. Monique asks, if we already have our own templates, policies, and procedures, can we bring our own documents and resources, or do we need to use Alpacas only? Alpacas are just templates. No, we are not forcing providers to use our documentation. We encourage them to adapt it to their own practice, to their own circumstances, to their own providers, to their own clinical model. So please feel free to bring your own resources, especially if you've already developed them. Are we familiar with Minnesota? To some extent, we don't do any work there, but it sounds like we might do some work there with you, Diaj. With 2 minutes remaining, I am just going to do a quick plug for the rest of our webinar series. So we're going to keep doing these webinars because we want to just provide a little bit of education about what it would be like to start a practice. So if you go to our website, you should see a webinars tab. And that webinars tab will lead you to a page that looks like this, where you can see past webinars. So you can see our Accounting 101 webinar about taxes, S Corp, and corporation. You'll see our webinar that has a comprehensive step-to-step guide of starting an ABA practice. You'll also see upcoming events. We will be doing one next week about IT compliance, week after that about taxes, week after that about best practices for BT supervision. So please, if you found this helpful, sign up for one of the next webinars. And if you don't see a webinar on there that you'd like us to do, email me or just put it in the chat here. I'd love to get your feedback about what other questions, concerns are on your mind as you hopefully consider starting your own independent ABA practice. One question, and this is a good one. How do you recommend BCBAs start their own company on the side while still working another full-time job? That's the scariest. Yes. We work with a lot of BCBAs who take this path for obvious reasons. My recommendation is starting small. A win for you in this case is not 12 clients. A win for you is one client. Literally just one client. Doesn't matter the number of hours, the type of case, just one client online. It could be just like 2 parent training sessions a week or 5 direct therapy sessions that you're doing. You're fitting in your schedule. Or 1 BT that you just know maybe from your clinic right now who needs some additional hours and you're able to provide it to them in the private practice. So it is obviously not easy, but it's totally possible to start this as a side gig. And as it grows, you can taper off your commitment with your full-time job. And I guess the other kind of piece of things is from a time management perspective, what we've told our BCBAs or recommended to them is set aside 5 hours Sunday afternoon, 2 hours Saturday morning, an hour a night, even whatever fits your schedule, and just block it off in your calendar and dedicate that to building up your own practice. It's going to take work, but it's worth the investment with the practice that you're going to be able to build, the financial stability and independence you're going to be able to build for yourself. And frankly, the probably better clinical community you're able to develop versus your current workplace. So it'll be hard. Don't get me wrong. But I would certainly argue that the benefits outweigh the current one. And happy to talk more about it one-on-one if you have kind of more questions about it, and even make some intros to BCBAs who have started their practice in this way so that you get some kind of tips and guidance from someone who's not just me. We are a little bit over time here. I want to thank each and every one of you for hanging out with me Tuesday night. I know everybody's crazy busy. I would love to meet you if you're thinking about starting your own practice. So please find me on LinkedIn, go to our website, book some time. Otherwise, I hope to see you at our next webinar, which I think is May 7th. Thank you guys. Have a good one.